Welcome back guys. Now in this video, let's discuss about hemodynamics. Students, now tell me what is the meaning of the word hemo means? Hemo means blood. We all know hemo means blood, and dynamics means movement. Okay, dynamics, movement. So here we are going to discuss about how the blood is moving inside the blood vessel. Okay, so what are the factors which are affecting the flow of blood? See, usually the blood, it flows in laminar fashion, also called as a streamline flow. The blood inside our blood vessels is going in a laminar fashion. For example, look at here. See, from this tube, let's say, how the water is coming. See, the water is coming in a more streamlined fashion. So, such kind of flow is called as laminar flow. But if the fluids are coming out with a more haphazard way, that is called as a turbulence flow. Okay. So, in our blood vessel, how the blood is going? Is it going in a laminar flow or in turbulent flow? It is laminar flow. Okay. So, the blood is moving very smoothly inside the blood vessel. So, how the question was asked? When the blood is going in a laminar fashion, which cells occupy the central column of the blood vessel? So, this was the question asked. Imagine this is the blood vessel, and inside the blood vessel, the blood is going in a more streamlined flow, in a smooth way the blood is going. So, which cells are going to be present in the central column, of the blood vessel? Which cells are traveling, and which cells are present on the peripheral area? Okay. So, the cells which are in the center, always they are RBCs. RBCs are always in the center, and WBCs are always on the periphery. WBC are like bodyguard, they are on the periphery. RBC are in the center. Okay, they are traveling in the center. Okay, now what exactly is this Poiseuille-Hagen formula talking about? See, Poiseuille-Hagen's formula is talking about the blood flow, the flow of blood. Okay, the blood flow, it is dependent on, directly proportional to 4 parameters. These are the 4 parameters which are going to decide the flow of blood. So, what are they? Blood flow is directly proportional to the pressure difference and radius to the power of 4, but indirectly related to or inversely proportional to length and viscosity. So, how to understand this? So, let me give you with examples. Okay. So, students, look at here. I am drawing one blood vessel. See, here there is a blood vessel, and there is one more blood vessel here. Okay, blood vessel A and blood vessel B, let's say. 2 blood vessels are there. What is something common between them? See, length is common, let's say LL. Okay, even though they are looking little bit different. Okay, let me correct it. Okay, so both length is L and L, both length L and L. But what is the difference is the radius. The radius of the first one is R. Here the radius is 2R, double the radius. Okay, radius is different. Now, in which blood vessel do you think more blood is going to go? So, here in A or in B, where do you think more blood will go? So, more blood is going to go in B definitely, because there is big blood vessel, it is a big blood vessel, so more blood is going to go. So, now how many times more blood will go? Let us say here 1 ml, for example 1 ml blood is passing, okay, 1 ml blood is passing in first blood vessel. How many ml is going to pass in the blood vessel B? Here the radius is R, here the radius is 2R, double the radius. So, here 2 ml blood is going to go. No, 2 ml blood is not going to go there. So, usually students will think, sir, double the radius, so double the blood flow. No, it is not like that. So, let us come to the Poiseuille-Hagen's formula. What Poiseuille-Hagen's formula is talking about? Blood flow is directly proportional to radius to the power of 4, R to the power of 4. It is not just R, it is the R to the power of 4. So, I can say here in my case radius is doubled. Okay, radius is become 2R, so I am keeping 2 here. So, 2 to the power of 4 how much? Means 2 into 2 into 2 into 2 means 4 times, 2 into 2 into 2 into 2. So, that is 16 times. So, blood flow is going to increase by 16 times. So, if here 1 ml blood is passing, here 16 ml blood will go, 16 ml blood is going to pass. So, that is what, if you just dilate a blood vessel, if you increase the radius, if you double the radius, 16 times more blood is going to flow. Now, instead of keeping here 2R, let us say I am making it 3R, triple the radius. What will happen? So, if you are tripling the radius, then 3 to the power of 4, 3 into 3 into 3 into 3. So that is 81 times more blood is going to go. So it's not just directly proportional, it's not directly proportional to the radius, r to the power of 4 times. Okay. Now you might be thinking, sir, why blood flow is increasing? Okay, blood flow is, when compared to the blood vessel A, blood vessel B has more blood flow, no doubt more blood flow is there, but why? What is the reason? Why, if the radius is going to increase, blood flow is increasing, but why? Why more blood is going? It's because you have to know one more formula, that is resistance is inversely proportional to radius to the power of 4. Opposite, both are opposite. So resistance inside a blood vessel is inversely proportional to the radius to the power of 4, which means in our case what I have done? In our case I have double the radius. So what will happen? Double the radius means what? 16 times. It's not 1 by 16 times, guys, it is inversely proportional. So resistance is going to increase by how many times? 16, resistance is going to decrease by 16 times. Okay, what happened? If you double the radius, what happens? If you increase, you are increasing the radius. When you increase the radius, what happened to the resistance? Resistance decreases by 16 times. 16 times the resistance will decrease. Okay, so look at here, if you double the radius, 16 times resistance decreases here. Whenever 16 times there is less resistance, 16 times more blood flow. Okay, now you understand. So let's fill up this. If the radius of the blood vessel, now tell me, if the radius of the blood vessel doubles, what happens to the blood flow? So blood flow is going to increase by 16 times. Blood flow increases by 16 times. If the radius of the blood vessel triples, look at the second question. If the radius of the blood vessel triples, what happens to the blood flow? Blood flow is going to increase by 81 times. Why? Because I have told you resistance inside the blood vessel. Look at this. Resistance inside the blood vessel is inversely proportional to radius. Okay, what will happen? So whenever the radius doubles, okay, resistance is going to decrease by 16 times. Okay, now look at this statement and tell me. Look at here. So whenever the radius doubles, first resistance decreases by 16 times. So blood flow increases by 16 times. Okay, now based on the same concept, based on the same logic, now try to answer this question. Amount of blood flow in blood vessel B when compared to blood vessel A. Simple. Look at here, my dear students, here R, here radius is 2R. When compared to A, here the radius is 2R. So tell me, when compared to A, how many times more blood is going to go in B? 16 times more blood is going to go? No, not 16 times. Now you will think, sir, just now you told whenever you double the radius means like 16 times more blood flow. No, look here. Here not only radius is increasing, but also length is also increasing. Okay, so whenever you are increasing length, I have told you length is bad, length is inversely proportional. Look here, whenever length increases, blood flow will come down. So let's write according to our formula. Blood flow is directly proportional to the radius to the power of 4, but inversely proportional to the length. So what I have done with the radius, it is 2 to the power of 4, but length also doubled. So that is 16 divided by 2, how much? 16 divided by 2, 8 times. So now here in blood vessel B, there is going to be 8 times more blood flow. Why not 16 times? Because not only radius is increased, but also length is increased. Length is going to create more friction. So that's going to decrease the blood flow. Okay. So this is how you can expect the MCQs in your exam. Okay. Next, now let me ask you, let's say the patient is suffering with, okay, a patient is suffering with polycythemia. What do you think will happen to his blood flow? Polycythemia. Polycythemia means what? You know, polycythemia is because of the JAK2 mutation, okay, Janus kinase 2 mutation. Polycythemia means there is going to be more RBC, it's a RBC cancer, you know, okay, cancer of the RBC, red blood cells. Whenever there is more RBC, how the blood is going to be? There is going to be more viscous blood. There is going to be thick blood. So now you tell me, whenever there is more viscous blood, do you think the blood can go easily? No. So whenever the viscosity increases, according to our Poiseuille-Higgins formula, whenever the viscosity increases, what will happen to the blood flow? The blood flow is going to decrease. So viscosity increases means blood flow will decrease blood flow. Next, what happens to the blood flow in a patient who is suffering with Cushing syndrome? Okay, Cushing syndrome. You tell me. I have taught you in endocrinology, Cushing syndrome is a condition where there is cortisol excess, there is excess amount of cortisol. Cortisol is going to increase the number of your RBC, platelets. Okay, it's going to decrease your WBC, except the neutrophils and the monocytes. Okay, monocytes increases, neutrophils increases, RBC increases, platelet increases, but all other WBC will decrease. So because of this increase in the number of RBC, platelets and neutrophils, the blood is going to become viscous. In Cushing syndrome also, there is going to be hyperviscosity of the blood. So that hyperviscosity is going to decrease the blood flow. There is going to be more stasis. The blood is going more slowly. Okay. Now you tell me what about the anemia? In anemia, there is going to be hyperdynamic circulation. In anemia, the blood is diluted. Okay. Let's say the patient is having hemolytic anemia, where the RBCs are getting destroyed. Okay. Intravascular hemolysis is happening. So the number of cells are going to go down. So the blood is going to become more diluted. So there is going to be more blood flow. Okay. So this is what I want you to know. So what are the parameters on which the blood flow is dependent on? There are 4 parameters on which the blood flow is dependent on. That is Poiseuille-Huygens formula. What are the 4 parameters? Pressure difference, radius, length and viscosity. I have explained you everything about the radius. Double the radius, 16 times more blood flow. Triple the radius, 81 times more blood flow. What about the length? Whenever the length increases, blood flow will decrease. And what about the viscosity? Whenever the viscosity increases, the blood flow will decrease. What about the pressure difference? More the pressure difference across the blood vessel, more the blood flow will be. Okay. For example, let me show you here 2 blood vessels. See, here there is a blood vessel A, here there is a blood vessel B, same length, same radius, everything same. Here in the starting point, this is the starting point of the blood vessel, this is the ending point. Starting point, ending point. In the starting point, the pressure is, let's say, 100 mmHg, and the ending point, the pressure is 99 mmHg. In the blood vessel B, the starting point, the pressure is 100 mmHg, and the ending point 1 mmHg. So now tell me, in which blood vessel do you think the blood flow is going to be there? See here 100, 99, 100, 1. So there is pressure difference, high pressure, low pressure, high pressure, low pressure. So definitely in both the blood vessels, the blood is going to flow. But in which blood vessel do you think the more blood is going? So more the pressure difference, more flow is going to be there. Less the pressure difference, less flow is going to be there. So blood flow is not only dependent on the length, the viscosity and the radius, but also depends on the pressure difference across the blood vessel. More the delta P, more the blood flow will be. Okay. So this one thing. Next, one more clinical question which I want you to know for your exams. Let's say the patient has donated a kidney, one of his kidney. Okay. In a patient with, there is a patient, the patient has donated kidney. Now in such patient, what will happen to the vascular resistance? And what will happen to the blood flow or cardiac output or stroke volume? What will happen? What do you think will happen? In a patient who has donated a kidney, what will be expected? What do you think will happen to his vascular resistance, and what do you think will happen to his cardiac output or blood flow? What do you think? It's a little tricky question. Guys, try to understand. Okay, imagine this is your college. Okay, try to understand, this is the college, this is your college. From your college, this is the road coming, main road, let's say. From this main road, there are multiple small roads that are emerging. Okay, these are the different roads. So different students are going to take this different roads to go to their home. Okay, try to understand like this. Here is your college. From the college, this is the main entrance of the college. From here, you are going to take the highway, and from the highway, you are going to take different routes to go to your home. Okay. Now, today, let's say, what happened? In one of the road, there is some accident or some construction work is going on. So you have blocked this road. Because of some reason, the road is blocked. In this road, there is a blockage. So now tell me, what will happen to the traffic in the other roads? When one road is blocked, so all the people now will come to the other roads to go to their destination. So what will happen to the traffic in these other roads? Now the traffic in the other roads is going to increase. Now tell me, is it easy for the people to go through these roads? Is it easy for the people to go through these roads? No, definitely not. It's very hard for the people to go through these roads, because there is more resistance is there. People are not moving easily. The vehicles are not moving easily because a lot of traffic is there. In the same way, see, whenever you have removed one organ, let's say this is the blood vessel, see, from the aorta, now let's come back. Imagine this is the heart, okay, the left ventricle, this is the LV, left ventricle. From the left ventricle, here is the aorta, and from the aorta, there are multiple arteries coming, coronary arteries, carotid arteries, renal artery, different arteries are coming, okay. So now today what you have done, you have removed the kidney, okay, kidney is removed. So when you have removed the kidney, what you have done with the renal artery, it is ligated, okay, you are closing this. So now tell me, when one of the blood vessel is removed, now tell me, what will happen to the resistance in the other blood vessels? The resistance in the other blood vessels increases. Usually students will think, oh, more the number of blood vessels, sir, more vascular resistance. No, more the number of blood vessels, less will be the resistance for the blood flow. Here the blood vessel, if you remove this blood vessel, if you ligate this blood vessel, now there is more resistance for the flow of blood in the other blood vessels. There is going to be more resistance because less number of blood vessels are available. Now the same 5 liters blood has to go through less number of blood vessels. So there is going to be more resistance. With more resistance, do you think the blood can go easily? Definitely not. So blood flow is going to be definitely less. Blood flow is going to be decreased. Blood flow, the blood is not moving easily. So there is going to be more resistance. And you tell me, whenever there is more resistance, okay, there is more blood pressure here. In these areas, there is going to be more blood pressure. Blood is not moving easily. There is more accumulation of blood, more blood pressure. So in these conditions, do you think the heart can pump easily? Do you think the heart can push the blood into the blood vessels easily? No, because there is more resistance. More the resistance means it is hard. It is hard for the heart to push the blood, pump the blood. So what will happen? The stroke volume decreases, cardiac output decreases. There is going to be less cardiac output. So in a patient who has donated the kidney, his stroke volume is going to be less, the cardiac output is going to be less, the blood flow is going to be less, the flow of blood is going to be less because of the more vascular resistance. Okay. So this is one of the favorite questions which was asked many times in the exams, which I want you to know for your exams. Okay, the concept. Okay. So with this, the Poiseuille-Higgins formula topic completed. Hope the video is helpful for you. Thank you.